Hello, everyone, and welcome to the We Will Listen podcast. Today, we have a very special guest here with us. Osheen, would you like to introduce yourself?
First of all, thank you for this opportunity, Karan. I was quite frankly looking forward to being on a podcast which does incorporate issues that concern me, psychology for that matter. And hi, guys, my name is Osheen, and I'm a first year student at Delhi University, and I study psychology honors, and currently I'm in my second semester. And today I'm here to debunk the myths about the discipline and just bringing on light to all of the false information that's been circulated around regarding mental health and people who work in clinical settings and how to preserve the sanctity of such a beautiful discipline as psychology. So, yeah.
Thank you so much for that beautiful introduction. And it's all our pleasure that you are here. So, I'll get right to the point. So, Oshindi, you know that mental health is a very hot topic right now, and a lot of people are trying to talk about it. But a
Yeah.
lot of people talking about is not enough. The people need to talk right about it. The stuff they are speaking needs to be right. But nowadays, what I see on the internet, a lot of people are trying to talk about it, but what they're doing is they're giving out false information. They're trying to give away, solutions to it, and those solutions
Hmm.
are not necessarily right. And I want to know your opinion how this is adding to the mental health stigma, and how it might be even
Hmm.
preventing people from taking help.
Okay, Karan, first of all, I would like to, start off with a very clear distinction and a statement that's being used around more so often in our field just to do away with any kind of false information that's being circulated around mental health, which is talking is not therapy and therapy is not talking. And therapeutic procedures are a very technical and distinctive disciplines that help people come out of psychological disorders, and talking is not the same. And first of all, like I would like to say that, okay, um, talking about mental health started as a good thing if we look at in a chronological or spectrum perspective, because it just brought out in the forefront an issue that was already a taboo for so long. So I wouldn't completely shun away from people who are actually spreading good things, good awareness, good debunking the myths regarding mental health on various platforms. But I do have a problem with people who are just talking about mental health for the sake of it, for the fact that it's a hot topic to talk about, for gaining influences, and just that the famous line that they say that I okay, just DM me, I can hear you and stuff. I don't think that's right, because it's encouraging bad experiences in people from unprofessional individuals who actually are suffering, and b, it's actually preventing people from seeking professional help that can actually aid them in relieve them from their psychological distresses in the long run. So I think what we need to focus right now is, because enough has been said about mental health anyway, right? What we need to focus right now here is that we need to go a stage above, which is talking the right things about mental health and just not talking about mental health for the sake of it.
Yeah, thank you. That is why I wanted to bring this up, because a lot of I'll say colleagues, because I run a mental health page and I run a mental health
Right.
podcast, and a lot of people who are around me and a lot of people I've seen on the internet, what they are trying to do is that they are doing it because it's a very hot topic. The reason being they try to extract some fame from it, and it's not some fame, they just want to do something about it. So I'll say
Yeah,
not everybody has a malintention in their heart about it, but the
for
issue is
sure.
that even if you don't have a malintention, giving out the wrong solutions, giving out basically, there is a very famous line that wrong information is better than no information. I'm so sorry. No information is
Agreed.
better than
Sure
wrong
thing.
information.
Wrong
I'm
information.
so sorry.
Yeah.
So the point
No,
is
no.
that if you think that you know something and it's actually wrong,
Hmm.
that is even worse than not knowing about something. Why? Because then you'll be open to gaining knowledge about the thing, about the actual thing. You'll be open to gaining
Yeah.
actual knowledge. But if you
See,
know something, if you think you know something and it's wrong, you'll be a bit repulsive. You'll be a bit defensive about gaining
towards
actual knowledge.
the right information about it, certainly, because see, if for instance, if someone is introduced to topics such as anxiety and depression, and he or she has seen it in a very romanticizing perspective, like wearing t-shirts of anxiety, I have this, I have depression. And even though they might not, I'm not invalidating anyone's feelings, but what they might feel is anxiousness, which is very common, which is a very common human emotion, and not prolonged chronic anxiety. But what I think is that the more people are getting exposed to false information, the more reluctant and repulsive they're becoming to changing their opinions. Because that's how group polarization works, right, Karan? Right. For instance, an individual comes across a page which glorifies having mental disorders or anxiety, because apparently it makes you different and deviates you from the population. That's not correct, because people who actually have an anxiety disorder, who are actually facing the distresses and the dysfunction in their lives on daily basis because of it, the threshold of having an anxiety disorder that can actually bring dysfunction in your life is just it'll just go up day by day, because everyone has anxieties, and people who actually have it cannot now claim that, oh shit, I have an anxiety disorder, it is bringing dysfunction in my daily life, but what should I do? Everyone is having anxiety, so is my anxiety even real? So I think the first consequence of false information being circulated about mental health and psychological disorders is on the clients and the patients and the subjects and individuals who actually have psychological disorders cannot talk about it, because it's just so talked about, and I don't know, even have a problem with it being talked about that much. All I have a problem with is that it's being talked about in a very false perspective and dim light, and it's just doing away with the reality of people who actually have the disorders,
Yeah,
right?
that is the point. And this misinformation creates a lot of problems, as you said. So I like to
Yeah.
address another. It's not a misinformation. Also, this is somewhat of a confusion amongst a lot of people, and I wanted to address this on the podcast. I would
Right.
like you
Hmm.
to tell our audience what is the difference between a psychiatrist, a psychologist researcher, and a therapist.
Therapist. Okay. Very good question indeed, because I think most people don't know about the distinction between what's a psychiatrist and what's a psychologist. So just consider this. Okay. Consider a psychiatrist as the doctor of the brain, and psychologist as doctor of the mind. Now, Karan, I would like I just reckon that when we are introduced to this discipline, like on the very beginning, we are taught this distinction between brain and mind. So how we define it is like brain is a tangible, physical, biological entity, while mind is a manifestation of the brain. It's like this intrapsychic force that comes out of your brain. It's not tangible. So how I'll say this, that the debate about consciousness and mind being existent, it is very much because that's how we feel our emotions. And I would like to tell people that the first point of contact when a person has a psychological disorder is a therapist, a psychologist or a therapist. So a clinical setting works like this. The first point of contact is a psychologist. You are brought into the therapeutic setting. You are asked like which school of thought, therapeutic setting you will be willing to take, whether it will be psychoanalysis, whether it be humanistic, or combination of CBT and just Rogerian therapy. And if the root of the problem, if the root of the, let's just say, major depressive disorder is more on the biological spectrum of things, then the therapeutic procedures would be much better aided by providing or prescribing a medication, which will be done by a psychiatrist. Okay. So usually how it works is that therapy and the medication works hand in hand. And that's why like a psychiatrist and a psychologist work in the same setting. Now, if you say that, I'll be approaching a psychiatrist for therapy, I would doubt that, because psychiatrists are trained in providing medication to a psychological disorder, not treating it with a therapeutic procedure, right? And moving on, so the four domains in this discipline of psychiatry and psychology is a psychiatrist, a psychologist, a psychological researcher, and the fourth one is a therapist. So I already talked about what's the difference between a psychiatrist and a therapist, right? So what a psychological researcher does is that, like I told you, right? Psychology is very much behavioral science, right? And how we start with executing therapeutic procedure is by researching them on a sample population or a population. So we start with a hypothesis. For instance, CBT works in people who have phobias, for instance. That's your hypothesis, and then we'll test the theory or the therapeutic procedure on that population, and we'll confirm the hypothesis, and journals would be written on it for psychologists to follow and provide therapy for. Okay. Now that's what a researcher does. A researcher researches about the various domains and possibilities in therapeutic procedures or anything ranging from cognitive sciences or neuroscience scientists science, and applies them on a population for therapists to follow, right? Now, fourth one is a psychologist, right? So we talked about a psychiatrist, a therapist, a researcher, and a normal psychologist. So a normal psychologist is a very broad term. It kind of caters to a myriad of professions, ranging from counselor, ranging from a psychologist who works in the health setting, a psychologist who provides aids to cancer patients, that's called a psycho-oncologist. So it's like a parent umbrella term, in the ambit of which a researcher, a psychiatrist, and a psychologist, therapist comes.
Okay, so when we call a person a shrink, that is actually the wrong term, right? It is under the umbrella term of a psychologist.
Yeah, absolutely. And usually, what I kind of came to know like a couple of months ago, like since I started going to college and talking with my professors and stuff, most researchers, most psychologists who identify as researchers, tend to kind of categorize themselves with the more of the academic community, because they are kind of researching on things, and psychology just happens to be their domain. So they are researchers who are studying psychology.
Okay, so it's just a difference in the terminology.
It's just a difference in the terminology, yeah. But what I'm saying is that for instance, if you've been in contact with a person who has a psych D or a PhD in psychology, just refer to them as a researcher, more of as a psychologist, because they are basically researching on a discipline that just happens to be psychology, right? And usually when you get into academia research now, your discipline doesn't remain constant. I mean, you can go from bringing in a hypothesis from social psychological theories to going into psychoanalysis and even neuroscience. So I don't think just labeling them is enough. It does not do justice to their profession, is all I'm saying.
Yeah, actually, this was very informative. Thank you, Osheen,
Yeah,
for being here. It has been a really fun ride.
my
I will
pleasure, my
surely
pleasure.
see you again on this podcast again. It was really informative.
I'm
I
having
think
fun, so much fun doing this.
I'm
Okay.
hoping that all of our audience got to learn something. And I think that's it for this one. We'll see you guys in the next one.
Yeah.
Peace.
All right. Bye bye. Thank you.